What's going on, everybody? You are listening to the Strength and Knowledge podcast. This is Dr. Zach Baker, and I have with me today Dr. Josh Funk, and we're going to be talking about a recent topic that just came up in the physical therapy world, where in the U.S. military, physical therapists are now positioned to serve as primary care providers throughout the U.S. military for musculoskeletal conditions. This is a pretty cool development. I think it helps to validate what we are and the value that we bring in the healthcare space, in a very niche population of the healthcare space, as part of a larger healthcare team. You've seen this happening across the country with regards to direct access rules and being able to initiate physical therapy care in certain states, us being fortunate in the state of Maryland, where individuals can come in and seek out PT care without needing a referral or a script from their primary care or another physician, which it's awesome. It eliminates the barriers to entry. It gets people access to healthcare quicker, and we're seeing very good outcomes with that. Josh, I know this is something that, as a business owner, you've been a huge advocate for in the outpatient private practice space. When you see this article of how PTs are being utilized in the U.S. military now, what does that bring to mind for you, and what do you envision that kind of doing throughout the healthcare space, hopefully?
I think it brings a ton of legitimacy to our profession and the direct access movement. I think when you look at the military as being intricately involved with one of the most well-established organizations associated with this country, it gives a little bit more, again, legitimacy to the fact that we have a profession. We want direct access. We want to be able to go direct to consumer. We want to save time and money for people. In situations today where you could wait for weeks for a primary care or orthopedic at times, why not cut straight to it? Say that, hey, these individuals are the conservative care providers of choice for musculoskeletal issues. Put them in the driver's seat to do what they need to do to ideally save people time and money, but also save the system time and money, knowing that a lot of situations, especially with the number one musculoskeletal cost-related issue, which is low back pain, but decreased cost in the system. So I think overall it just adds a little bit extra support to us when we're out in the community and we're communicating to people what direct access is, especially for people who maybe have had more birthdays, who from a generational standpoint just are so used to going there to their physician first that, yes, this is a little bit more of a long-term game, but it puts ourselves in a situation where over the course of the next few years and decades, people will have no other way of interacting with the healthcare system other than going to PTs for MSK care.
Definitely, and I'm going to pull a quote from this article that was shared by the DoD where it says, the value in seeing a physical therapist first, both in terms of cost and outcomes, has been well established within the military health system, and the DoD decision is a clear acknowledgement of that reality. There is research to suggest that direct access to physical therapy is safe, effective, and will improve patient outcomes, military readiness, preservation of the force, and reduce cost. So everything that you had just kind of alluded to in your statement as well. And this has been an initiative of the APTA, the American Physical Therapy Association, for those unfamiliar, as a push to make physical therapists a more prominent role in the healthcare space when it comes to musculoskeletal injuries. There was a very large study that they had done a couple years back called the Economic Value of Physical Therapy in the United States. And that study looked at direct access and getting early access to physical therapists in regards to reducing the overall cost to the patient, the consumer, and just the healthcare landscape in regards to if somebody has a clear-cut musculoskeletal issue, 10, 20 years ago, before some of these laws were in effect, they had to see their primary care. Then they had to get referred out to an orthopedic. Then the orthopedic had to refer them to PT. And they may have needed imaging before they even got PT. We're looking at 2, 4, 6, maybe 8 weeks since the time of the injury, or maybe not even the time of the injury, but just the initiation of seeking care for that injury before they ever even saw a PT. And they had to go through potentially 2 other office visits, maybe medication, maybe a round of imaging. There is a lot of lag time and just cost associated with that. By the time they get to PT, they're either in terrible shape because they haven't done anything for the last 8 weeks to address this, or unfortunately, in some conditions, it's just kind of moved on and it resolved, but the patient doesn't even really know, like, why did I get injured in the first place? What factors were contributing to it? And how do I reduce the likelihood of this happening again? Because by the time they actually got to the provider, it was relatively resolved, but we don't know why or how it resolved. So I think this article, it's very nice to see because it's showing a validation from some pretty higher ups within the country in regards to how they view physical therapists. And I'm hoping this starts as either, I don't want to say serving as a precedent, but just showing the value of what can be done if we integrate PTs as part of a more holistic healthcare system.
Yeah, and I think for people out there who maybe, aren't in the rehab space, who are consumers of healthcare, you may not be aware of the fact that the time period of which you have low back pain and the time period of which you then access a rehab professional is very, very important for your long-term outcomes. So what they're realizing more and more is that the ease of access and the time associated with you potentially getting to a conservative care professional is extremely important to the system, decreasing the overall level of cost in the system. So that is why they are removing layers. In addition to the fact that we used to do more imaging, now we're doing significantly less imaging. A lot of your insurance carriers are now going to say that you need to go through a round of physical therapy. So to put yourself in a position where you've done things to address through conservative measures under the belief that your image does not equal your pain in an overwhelming majority of situations. For back pain, neck pain, you're largely talking about a multifactorial situation. So can a conservative care professional address things in a more multifactorial way as opposed to looking at a picture and pointing to that as the sole reason? So, the time associated with you getting to care is extremely important. You not doing imaging is something that has been trending throughout the course of the healthcare system. And it ideally puts you as the consumer in a better situation short term and long term. At the end of the day, you are having discomfort. It is disrupting your everyday life, and you want to get information as quickly as possible. There's no point, I shouldn't say there's no point. There's very, very little point in you potentially going to a professional that's just going to kick you here, that then is going to have you get imaging, but at the end of the day, that tried and true method didn't work. And what they're realizing is that PTs, as those frontline providers, actually at this stage of the game is the best possible route for you.
Yeah, and piggybacking off of that as well, if you have significant back pain, you have significant neck pain, I pull those two examples because there's a lot of literature and just historical information with it. But if you're not getting physical therapy or conservative management, what is often the alternative? Pain medication. And unfortunately, sometimes some heavy hitter pain medication. Now, in the recent years, there has been, I don't want to say a crackdown, but there's been more of a regulation restriction, and I'll just say general oversight of how medicine is being prescribed with regards to the frequency, how much, what is the criteria for that. So it's not as, I don't want to say as prevalent because it is still out there, but think about like the opioid epidemic and all the things that are going on with that. One of the largest factors to dependence on these medications is duration of use. And it happens pretty quickly. Even as long as 1 to 2 weeks, your likelihood of becoming hooked to it and becoming reliant, whether physically or chemically dependent on it, increases exponentially. So think about how that factors in too, is if you have back pain, you have neck pain, and you have to go through this kind of hula hoop where, all right, I go to my primary care, I go to my ortho, I go to my neuro, I go to pain management. Now I get to go to PT, but it's been 4 to 6 weeks until I've got there, and I've been on meds for the last 4 to 5 weeks because it was the only thing that we could offer for help. Now we have kind of an uphill battle in regards to getting off of that medication and finding a more sustainable way to treat this condition. Whereas if you could have gotten into PT right from the beginning, we may never have even gotten prescribed pain medication in the first place, or we may have only been on it for 3 days, 4 days, 5 days, and then we're learning other strategies for how to avoid these excessive flare-ups, deal with symptoms in a non-pharmacological way when they do happen, and you have all of these other secondary issues or consequences, and often unintended consequences that come from having delayed access to healthcare.
And when you talk about other things that we have done in the past that have largely changed, we did a lot more back surgeries. We did a lot more back injections, both of those of which are more invasive and also potentially come with some side effects. When you talk about largely choosing a conservative rehab professional, a physical therapist, a chiropractor, you're in a situation where the downside or the side effects of that choice are minimal to none. So the healthcare system is telling you as the consumer, choose the conservative route, explore this to its fullest. You always have these options on the backside. But the worst thing would be to go and potentially get surgery for something where we're realizing largely that your image and whatever abnormality on that image most likely is not related to your pain. You have that expensive surgery. You're in the same position potentially that you were pre-surgery, and then you go to physical therapy. Well, let's kind of flip the script up. Why don't you go to the rehab professional, explore that opportunity throughout a full course of care, and if at still some point you're not doing better, I would still argue try a second place before you potentially get something that is permanent.
Yeah, and the one thing that I will say with this is the physical therapy education has changed over the last 20 to 30 years. It went from a bachelor's to a master's to what is now a doctorate degree. And part of that is in preparation for some of these changes where we can potentially be the first healthcare provider that individuals are seeing. Now, with that privilege comes a great deal of responsibility for PTs. So clinicians who are in this role, they have to continue to recognize, when am I not encountering a musculoskeletal patient? And just because somebody has back pain or neck pain or knee pain or ankle pain, it doesn't always mean that a bone, a ligament, a tissue, whether it's muscle, tendon, cartilage, is the source and the origin of that pain. And for those that are listening, I don't want you to get the impression that, oh, you have back pain, you have knee pain, you show up to PT and you just start blindly treating right away. There's still a screening and evaluation process that comes in. And part of our education is recognizing, when is this patient not a great fit for us, and we do need to refer them out. And the way that I look at it, if you see a PT first and you end up referring them out to a physician or and whether that's their primary care and more internal medicine, whether it's orthopedic, neurology, whatever the condition entails, the overall time frame is still extremely comparable to if they would have sought them out first and then were deemed musculoskeletal case and going to see PT. So I do want people to realize that there is still an evaluation that takes place. There's a screening procedure, both as part of the general intake process and the in-person process on that first encounter. And oftentimes, it's not unusual to have somebody make the recommendation to see an orthopedic or a neurologist or whoever from the other healthcare space, but continue PT intervention in the meantime. And I think a lot of times it's not this task needs to precede the other. It's they are both probably going to happen at the same time frame and overlap. But if we can initiate intervention early on as well, then, hey, maybe I need imaging. It's just not drastically going to change plan of care within the first 7 to 14 days that we see that individual. So we don't need to get the image and then go to PT. We can get PT as we're scheduling the image in advance. So I do want people to just be mindful that part of our education is screening. We do work hand in hand with physicians, and we do recognize when it is no longer within our scope of practice and it needs to be referred out. And I think this is really just a trend towards getting rid of sort of that kind of algorithmic approach of, oh, we need to do this and then that, and you have this sequential order of events, whereas we need all of these things to happen, but what is the most time-effective manner to complete this in?
And for anybody out there who may have taken this a different way, we are not dismissing or devaluing other medical professionals. We are merely just communicating to you, the consumer, that this is how you should interact with the healthcare system. If everybody is going to primary care and they're not all appropriate to go there first, that overburdens those providers, potentially with a situation where that individual could have gone elsewhere. Same thing for the orthopedic. So this should put you in a position where you just have a better idea of where to go first, knowing like that as Zach was alluding to, that when you are working with a physical therapist, and let's say you have back pain, there are certain screens and assessments that we are going through to determine appropriateness for our world. There could be things that pop up through the screening and assessment process where we go, hey, something more serious is going on, and we're potentially getting on the phone with another medical professional to get you in and get you seen because you are no longer appropriate for our style of intervention. So that's just something I think that's very, very important. This world where the healthcare system is more it's more utilized. It is overburdened in certain places. And this just allows you to interact with the individuals of who you should be interacting with first.
And to piggyback off that, and that's kind of my closing thought, is I think about how a lot of orthopedic offices have kind of evolved in the last several years, where it is very difficult to get an appointment with an orthopedic surgeon. And part of the reason is because they don't see patients every day of the week because they have to perform surgeries on some of those days of the week. And then guess what happens after they perform a surgery on somebody? They need to do follow-up appointments with the individual they perform surgery on. So their schedule fills up pretty quick with definitive surgical consults, surgical appointments, and post-surgical follow-ups. If we're flooding their offices with non-surgical or non-urgent medical conditions, that could be seen either by just their sports medicine physician who does not do surgeries at their office, or another healthcare provider like a physical therapist, that drastically reduces the wait list and the overall volume that surgeon is seeing patients for. And if we have a mild hamstring strain that does not require an orthopedic surgeon to make a judgment on or develop a plan of care, then that frees up an appointment slot for somebody else that has an ACL tear or a rotator cuff tear. And if they can get that surgery in 2 weeks as opposed to 6 weeks because that orthopedic's available, this is where you start to see the whole healthcare system become a little bit more efficient.
It's not best for people with colds to go to the ER. It's not best for people with very, very minor issues to go to an orthopedic surgeon. And it's not best for individuals that have undergone some kind of serious trauma, let's say a car accident or something like that, to go to a PT first. All this is doing is making sure that you as the consumer have the ability to go to the individual whom is your best choice in the healthcare system.
Perfect. And I think what that puts the onus on us now is educating the masses. And how do we determine who our direct access person is? How do we stratify and classify people into this is a good PT case, this is a good primary care physician case, this is a good orthopedic case, this is a get your butt to the emergency room type case. And I really think that's where kind of over the next 10 years, we're going to see a push in the healthcare landscape from an efficiency standpoint. So Josh, as always, appreciate you finding the time to get on here and share your thoughts. You are listening to the Strength and Knowledge Podcast. This is Dr. Zach Baker. Please like, share, and subscribe if you enjoyed this episode, and stay tuned for our next episode.